I started a charity called Australian Refugee and Migrant Care Services after realizing that the suffering for refugees being settled in Australia doesn't end when they reach our shores. Armcare was established for the 12-year-old girl who's been here for 6 years, is almost deaf, can barely hear her teachers, and is yet to receive hearing aids. Armcare was established for the widow with 3 young children who can barely function because of post-traumatic stress disorder, and she's only received a non-therapeutic dose of an antidepressant after 5 years. And Armcare was established for the widower whose poorly controlled diabetes threatens to shorten his life and leave his disabled son without care. So what's going wrong? Well, to explain this, I'd like to ask the person at the left-hand end of each row to raise your hands, please. Thank you. And as we move across the rows, I'll ask every second person to raise your hands, please. There we go. Thank you. You can lower them now. Now, for those of you who raised your hands, you are refugees. You grew up in a remote village of subsistence farmers surrounded by jungle. You had no education and you're illiterate in your own language. There was no formal health service because your government has been waging war on your people for decades. As a young adult, you fled your home country after soldiers came, shooting, beating, and raping your fellow villagers. You witnessed the murder of your spouse, and you ran into the jungle with your 3 young children. Your 4th child ran in another direction, and you haven't seen her since. Thereafter, you endured 16 years of abject poverty, starvation rations, overcrowding, illness, boredom, and hopelessness in a refugee camp. When you arrived in Australia, your hopes were raised, but everything was so strange. Enormous buildings and highways, and even most of the foods were unfamiliar. For the first 6 months, you were helped by a settlement worker who took you to a house and showed you wonderful things like light switches and taps. You were shown how to catch public transport, go to the bank and the doctor, schools for your children, and a place for you to learn English. But it was all so overwhelming, and you can't remember much of it now. For over 12 years, you've been unable to sleep more than a couple of hours a night before being woken by nightmares in a state of terror. During the day, you feel anxiety and fear. You can't cope with normal sounds or crowded places. Your memory is shot, and you can't concentrate. The only relief from this torment would be suicide, but you fear for your children's futures. You feel completely adrift, and every small task is an insurmountable problem. And the stress of all this is adding confusion and disorientation to your fear, and your isolation intensifies your deep grief at the loss of all things familiar. You're not learning English because of your poor memory. But others in your class are learning quickly. They received an education in their home country. Your last vestige of self-esteem evaporates. But with as much concentration as you can muster, you can now draw a small, wobbly circle as your signature. And wherever you go, people ask you to sign here. And you've left papers with circles on them in many places. You feel ashamed that you're so disempowered and dependent upon others. And your dependence on your children who are now learning English is causing problems with parenting. Unless the health of you and your children improves, your illnesses will sabotage your efforts to learn English, integrate into society, study and find work. And you'll have a high chance of suffering long-term poverty and of developing social and behavioral problems. Now, for those of you who didn't raise your hands, I'd like you to imagine that you are doctors. You're a general practitioner and you own a busy practice. The waiting room is always full, and for things to function successfully, everything must run like clockwork. You've recently taken on refugee patients, and things are not going well. Many present with multiple complex health problems, which would challenge your expertise even in the most favorable of settings. But the barriers are making things almost impossible. Refugee patients often forget their appointments, arrive late, or simply turn up when they are ill. So now that you know who you are, patients and doctors, let's consider how you will interact. Doctors, working through interpreters is time-consuming and difficult. Patients, you're afraid of your doctor, as you are of anyone in a position of authority. Your past experience of them is dismal, to say the least. You're struggling to hear the interpreter over the telephone, and he's speaking a different dialect, which is making things even more difficult. You're shocked at the many personal questions that the doctor asks, and the loud and direct way that they are asked. This is simply not done in your culture, and you're not used to anyone making eye contact. You're forced to disclose things that you wouldn't even tell your spouse, let alone a stranger. So you evade questions and tell lies in order to not answer them. Now you feel embarrassed and violated, which adds anxiety to your fear. Doctors, you're finding it difficult to get a meaningful medical history, as you're getting inconsistent answers which don't fit any diagnostic picture. When you finally work out a course of action, it takes a long time to explain things, and even longer to explain medications. For what it's worth, refugee patients often get confused and take them incorrectly, forget to take them, and some even overdose themselves for a faster cure. And this has already put one of your patients in hospital. Patients, the interpreter is struggling to explain the big words that the doctor is using, as there are no words for them in your language. But it doesn't make any sense to you. The concepts are foreign, and you know that your illness is because of bad blood. In any case, your mind has gone blank because your anxiety has now turned into a full-blown panic attack, and it's all you can do not to get up and run out of the room. Doctors, you're using valuable time doing all of this, and your stress levels mount as you watch the clock. You refer the patient to the hospital, knowing that they won't be able to read the appointment letter that the hospital sends. And if by some chance they manage to get to the right place at the right time, there's a fair chance they'll be lost to follow-up, and crucial interventions will be missed. You're aware that these patients are under financial stress, so you're not charging them a gap fee. But with all the extra time and resources that they're taking up, you're actually losing money by seeing them. Most have social problems that you cannot solve, which work against a successful health outcome. Many of your colleagues have stopped accepting refugee patients through frustration, and you're tempted to do the same. So now you'll have some idea as to why the 12-year-old girl didn't get her hearing aids, and the mother with PTSD was being looked after by her young children, rather than the other way around. In fact, research tells us that for refugees being settled in Australia, there'll be a minimal change in self-reported health levels over time. And after 3 years, a higher proportion will still suffer poorer physical and mental health than the general Australian population. And that's known as a health gap. So in Australia, we not only have an Indigenous health gap, we have a refugee health gap as well. Clearly, there is a wide chasm between patient and doctor. Some excellent interventions have been put in place, but almost all of them are one-sided initiatives imposed by the health system, which still rely on the patient's ability to access services. In engineering terms, if we need to build a bridge over a wide ravine, we have to start building from both sides to eventually meet in the middle. So unless we enable and empower patients, refugee patients, to access services and play their part in their recovery, and enable and empower doctors to provide quality cross-cultural and trauma-informed care, one-sided initiatives will fail to achieve the results we desire. So what if I were to join your twosome? I'm an arm care worker who meets patient and doctor where they are at. I'm medically trained and I know how to navigate the health system. I'm also well known and trusted by the refugee community, and I have a strong knowledge of their history, refugee journey, language, culture, beliefs about illness, problems and needs. So patients, what if I were to come and spend a couple of hours with you with a face-to-face interpreter, and I'll explain to you why so many questions need to be asked. You'll feel more comfortable in your own home, and because of the way I frame the questions, you'll be happy to answer them. Doctors, I speak your medical language. I'll attend appointments with your patient, and I'm going to save you and your receptionists hours of time. Your patient will arrive on time, and you'll be able to spend your time practicing medicine without having to be a glorified social worker as well. I'll convey a full medical and social history to you within minutes, and you'll only have to ask a few extra questions while feeding on the trust that I already enjoy with the patient. You'll be able to quickly explain your diagnosis, tests required, medications and treatments, and you'll hand me all the paperwork. I'll make all the appointments. I'll take your patient outside and I'll make sure they understand things by explaining things in terms that they understand. I'll go with them to buy medicines and monitor response to treatment and compliance. I'll keep you updated on progress and I'll alert you should any problems occur. I'll make sure they correctly prepare for all their tests and attend all allied health, specialist and hospital appointments. And I'll inform and update all healthcare workers involved in their care to ensure continuity of care. And all those social problems that you couldn't solve, well, I'll get one of our social workers onto those. And that's not all. I'll be a mine of information to you. I'll inform you of what diseases to look for and how they manifest differently in this ethnic population. I'll direct you to the resources you need to upskill, and I'll help you to understand the language and cultural issues and the health effects of trauma. Lastly, I'll inform you of other services that are available and how to refer your patients to them. I guarantee that it won't be long before you find refugee health interesting, rewarding, and economically viable. Patients. Armcare provides health education and resources in your own language. And as your health improves, you will take on more and more responsibility until you can eventually manage your own health care. You'll be in a much better position to learn English, integrate into society, build social capacity, study, and you'll join other former clients in the workforce. And Armcare's impacts extend to the wider refugee community by increasing health literacy and the uptake of preventative health measures and disease screening services. We also reduce greatly the stigma of mental illness. For the wider Australian community, we're preventing the development of more serious health and social problems down the track. We're reducing missed hospital appointments. We're reducing hospital admissions, the inappropriate use of ambulances, and the duplication of services. We also curb the spread of communicable diseases. And one armcare worker saves government and refugees an absolute minimum of $4.23 million a year, as measured in 2017. And the cost of providing this service is well under 10% of that, which gives us a return on investment of at least 1,000%, which I'm sure you will agree is phenomenal by any standard. This year, government will select 18,750 refugees from around the world for settlement in Australia. And research tells us that 70% of them will have suffered some sort of psychological or physical violence, and 1 in 4 will have suffered severe torture and trauma. So we've shown that it makes sense to build the bridge from both sides. It always makes sense to relieve suffering, but we've also shown that it makes very attractive economic sense, which makes it an idea worth spreading.